Good evening, and thank you for joining us for this important discussion about gun violence in Maryland and how our lawmakers in the Maryland General Assembly are working with advocates and faith leaders to highlight the devastating impact of gun violence on Maryland's citizens and communities. Our speakers will help us understand their efforts to put forth meaningful solutions in Annapolis this legislative session. My name is Sheilah Kast. I host a show called On the Record on 88.1 FM WYPR Baltimore's NPR station. I'm so pleased I was asked to moderate tonight's discussion. I want to acknowledge the Maryland Catholic Conference, which organized tonight's virtual discussion and which continues to elevate important issues facing Maryland and its citizens. The conference, which represents the 3 Catholic dioceses of Maryland, is pleased to welcome tonight's panelist, led by the chair of the House Judiciary Committee, Baltimore Delegate Luke Clippinger, and by a longtime legislator from Baltimore's 41st District, Senator Jill P. Carter. They are joined by Myles Hicks, Deputy Legislative Officer for Maryland Governor Wes Moore, and by Dr. Thomas Scalea, Physician-in-Chief at the R. Adams Cowley Shock Trauma Center in Baltimore and Director of the Program in Trauma at the University of Maryland School of Medicine. And finally, representing the faith community in this important discussion is the Archbishop of Baltimore and Chairman of the Board of Governors of the Maryland Catholic Conference, Archbishop William Lori. Thank you all for being with us this evening. Before we dig into our discussion, let me ask Msgr. Rich Bozzelli, pastor of St. Bernardine Catholic Church in West Baltimore, to offer the opening prayer. Msgr. has spent much of his priestly ministry caring for inner city parishes and witnessing the impacts of gun violence that we will discuss tonight. Msgr.
Good evening, thank you. Let us pray. Almighty God, you promise your people that if they humble themselves and pray, if they seek your face and turn from their wicked ways, you will hear them from heaven. You will forgive their sin and you will heal their land. Dear God, our land needs healing. Our land needs healing now. Violence and the destruction that guns bring to our neighborhoods and communities are the concern of each one of us. Receive into your loving care the victims of violence, soften the hearts of those who resort to violence, console the families and friends of victims and perpetrators of violence, strengthen the hands of our first responders, and open the hearts and minds of our public officials. Help our communities to counter gun violence, help our political leaders to enact change, and help us all to be witnesses to your peace and justice. Turn our sadness into compassion, our weariness into advocacy, and our paralysis into action. We ask this in your most holy name, one God, forever and ever. Amen.
Msgr. thank you. So the plan for this evening is that each panelist has been asked to offer a brief opening statement, and that will be followed by discussion and responses to pre-submitted questions. Audience members joining us via Facebook and YouTube can submit questions during the event by using the chat function or by email at communications@mdcatholic.org. We will try to get to as many questions as we can during our allotted time. Again, the email address is communications@mdcatholic.org. And now I'd like to introduce our first panelist, Delegate Clippinger, who represents the 46th District in Baltimore City. He's been a member of the House of Delegates since 2011, and as I said, he chairs the House Judiciary Committee. He's an active proponent for legislative solutions to Maryland's epidemic of gun violence, and last year oversaw passage of legislation that banned so-called ghost guns. He previously worked to close loopholes in buying shotguns and rifles. In addition, Delegate Clippinger works as an assistant state's attorney in Anne Arundel County, where he prosecutes, among other crimes, the illegal possession of guns. Delegate Clippinger, thank you for being with us this evening. We're standing ready for your opening remarks.
Never gets old getting to unmute yourself. Thank you all very much for having me here this evening. I am, as it says, Delegate Luke Klippinger, and I'm very happy to be part of this discussion tonight. Guns and the scourge that they have, in some cases, imposed on our society has been an issue that we have dealt with in this committee for years and will continue to deal with. It's an issue that is extremely challenging and an issue that has been made in many ways more challenging by the Supreme Court's most recent ruling in Bruin, a decision that effectively eliminated components of Maryland's process for being able to apply for concealed carry of handguns. There are a lot of issues that we're going to be looking at this year, including how we address the issues that have come up in Bruin, and also issues related to the proper storage of regulated firearms. In Maryland, a regulated firearm is basically a handgun. So we're going to look at how to address issues related to those regulated firearms as well. Another issue that I think that where we certainly look forward to on the committee, and where I myself look forward to working with people here and across the district and across the state, I think is very important, connects back to something that Senator Carter and I worked on in the last legislative session related to juvenile justice. Unfortunately, it's becoming clearer at the end of the last term that there are some real structural issues at the Department of Juvenile Services. And one of the issues that we're going to need to take a closer look at has to do with what we can do to prevent illegal guns from ending up in the hands of children. This has been an issue in the past. It's been an issue that we've looked at a great deal in the past. But what I think we have the unique opportunity to do in this session and the next, I think over the next couple sessions, is to look at innovative solutions to really getting to the root causes of why kids feel the need to possess those guns and how they're getting a hold of those guns. A big part of the challenge is the flow of illegal firearms from all over the country that come to Maryland from a lot of different places. But we know who these kids are. They're in our communities, they're in our schools, and they are people who have perhaps even touched in our lives. And so we need to start thinking about how we can come up with real solutions for them. And I mention it in part because in my day job as a state's attorney, I do deal with kids, with people who are under 18, who are found to be in possession of firearms. And what I think public defenders and state's attorneys would all agree in saying is that we don't have not only don't we have a real strategy, we don't have a plan, real programming, real anything to deal with kids who are found to be delinquent on the basis of possessing those illegal firearms. And too often, my phone goes off and with a new text message from the Baltimore police saying that there's another shooting in another part of my district, and increasingly we're seeing kids involved more and more. So we need to figure out a way to deal with that global problem as we go forward. It's a vast issue. It's a challenging issue, and it's a challenging issue because of the constitutional aspect, because of so many other parts of our lives that have become, in many cases, unfortunately tied to firearms. We need to take on those challenges head on. I certainly look forward to working with the Senate this year and in future years as we seek to do that. So thank you for having me on.
Thank you, Delegate Klippinger. Also on the front lines with Delegate Klippinger on the safety issue in the Maryland General Assembly is our next panelist, Senator Jill P. Carter, who represents the 41st District and has been an outspoken advocate for gun control measures, as well as police reform and juvenile justice reform. After 14 years in the House, Senator Carter has been a member of the Senate since 2018. She serves on several panels, including the Judicial Proceedings Committee. She's also a member of the Legislative Black Caucus and the Maryland Violence Intervention and Prevention Advisory Council. During the 2022 election, Senator Carter cited public safety as the most pressing issue and is seen as a leader in the legislative fight to curb crime, violence, and injustice. Senator Carter, thank you for being with us this evening. I invite you to offer some opening remarks.
Thank you. Good evening, Sheilah, Kast. It's nice to see you. And I want to specifically thank you, Archbishop Lurie and Father Bozzelli, for inviting me to participate in this very important discussion. And I will say that, you know, as a lifelong resident of Baltimore City, as a Black woman and growing up in Baltimore City as a girl in Northwest Baltimore, now a woman, but also now a public servant, I want to speak from the heart as well as my opinions on policy. I think that this issue is such an important one, but it's one that we have to address both from a policy standpoint and a heart standpoint. We're in the position that we're in today because of the fact that we need a radical reformation of values. We have really acquiesced to the amorality of violence all over this world, from our own government and war to unjust policing, police violence, and now we are mostly talking about two types of violence in our society. We're talking about that awful situation of the mass shooting, or the person that maybe initially was legally in possession of a gun and then committed a bad act that harmed many people, or we're talking about the general ongoing violence in places like Baltimore City. One of the things that I want to make clear is that this General Assembly is 100% committed to doing everything this session that it can to address this issue. There are a multitude of different proposals on the table, but one thing I want to make clear is that this old, ill-conceived, and unsuccessful concept of over-policing, over-criminalizing, and over-penalizing for the being in the possession of illegal guns is not a solution that's going to dig us out of this hole. Some of the things, and there's not one solution, but some of the things that I think are critically important to be at the forefront of policy and discussion are, one, to continue to invest in anti-violence intervention that work and that are successful. I work with a lot of young people in my other life as a criminal defense attorney that represents a lot of youth. And I can tell you that what I see a lot of times, and it was exacerbated by the 2.5, 3 years of pandemic, where young people had very little structure, were not in school for the most part, and did not have things going on at home and community to occupy their time. That exacerbated a problem that already existed, with a lack of purpose, a lack of sense of worth. And as my friend Davon Love likes to say, the externalization of a suicidal ideation. Basically, what that is saying, that people that have no hope, people that have had no investment, people that have had decades and decades of school underfunding and horrifically terrible education, people that have had lead poisoning permeate a community with no real efforts to address it, are in now a situation where they don't have, for a lot of times, a high value on their own lives, much less that of others. And so one of the things we have to do is have honest conversations about how we repair the damage that has been done by a lot of the policies that we've had of the past. And with that being said, I'm going to highlight just a few bills that I know that we have that I think are important, because we have to attack this from every angle. You know, you're familiar with the, as Chair Klippinger said, the efforts around the Bruin case. So there's legislation that my committee has heard that would limit some of the places that persons that are legally in possession of gun would be able to carry them in the state of Maryland. There's another piece of legislation on the table that would increase the age that a person could legally have a gun to 21. And I think that's important discussion, because I've always said, and Archbishop Lurie and Father Bozzelli, you're well aware of my opinion on this, that we are very hypocritical about how we treat children, how we cherry pick who's a child and who is not. That's something that we need to address. I have a bill, Chair Clippinger, that actually passed the Senate before, but died in the House, and hopefully we can get that done. It's really a good piece of legislation that just one thing to add to the pot, which is this concept of a tax credit for those that store their gun properly. It's an incentive to do it right and to prevent situations like the gun that got into the hands of a 9-year-old that killed Nicole Estrada in my district. So I will end there. I'm happy to talk later about some of the other initiatives that we have, but I want to stress that this is about policy, but it's also about our values and how we come together as a society to change and reform some of the things, the amoral things that we've allowed to occur. Thank you.
Thank you, Senator Carter. And now we'll hear from Myles Hicks. Before joining Governor Moore's administration as Deputy Legislative Officer, Myles Hicks was Executive Director of Marylanders to Prevent Gun Violence and co-led the Maryland Violence Prevention Coalition. Prior to that, he served as Executive Director of Maryland Rise, a nonprofit that works to promote economic opportunity for Marylanders. Myles is a 2017 graduate of the University of Maryland College Park, where he was a Rawlings Undergraduate Leadership Fellow. Mr. Hicks, thank you for being with us tonight at what is, I'm sure, a very busy time for you. Please share your opening remarks.
Yes, and thank you for that kind introduction. And again, just want to shout out Catholic Conference, also Garrett and MJ. It's been great working with them over the last couple of years, and Maryland Catholic Conference is doing such great work in the community, and look forward to all their continued advocacy. Again, I'm excited to be here as a member of Governor Moore's legislative team. My portfolio covers labor, gaming, and criminal justice. Gun violence obviously falls directly into the criminal justice category. The work that everyone on this call is doing is really vital to the safety and long-term success of the state. I especially want to thank a lot of the survivors who are listening in on YouTube or on Facebook right now. One thing I do know from my time in this work is that sharing your story isn't always easy, and you guys bring a really interesting perspective to this topic, and your advocacy offers great insight that we can all utilize when we're going from conversation to conversation. It goes without saying that the gun violence that we're seeing in our state and across this country is unacceptable. We've seen people losing their lives to senseless gun violence every day, and needs to stop. And similar to Senator Carter, I feel what she says as a Black man who also lives in Baltimore City. I see so much of myself, so much of my brothers, so much of my family members and friends in these stories that we see every day. So when you see those lives get cut short, you understand that it's not just that person or their family being impacted, it's their whole network. That's, neighbors, friends, teachers, coaches are all involved in that process, that grieving process. So it's important that we're taking the steps to interrupt those cycles of violence, to get illegal guns off the streets, to create better pathways for these young people to actually express themselves, another way that's not violence. Again, the governor wants to prioritize the safety and prosperity for Marylanders. You want to feel safe in your own neighborhood, you want to feel safe in your own house, and you want to be able to go to school and feel safe within those walls. I'm extremely grateful to see so many great partners on this call. I've had some great times already sitting down in JPR and judiciary as this session has gone on, and look forward to continue to working with our legislators and other public officials to fight this epidemic of gun violence. During actually a couple of weeks back, during the governor's press conference with Mom Demand Action, he stated that he took gun violence personally. So it's our job in this legislative office to also do that as well. We look forward to, again, continue to partner with law enforcement, with mental health advocates, with community organizations to continue to make Maryland this great state and ensure that we're not leaving anyone behind. Again, thank you all so much for this time today. I look forward to continuing this conversation in the Q&A. And again, shout out to Maryland Catholic Conference for bringing together such great advocates and people in this room. Thank you.
Myles Hicks, thank you. Our next panelist this evening is Dr. Thomas Scalea. On the front lines of the gun violence epidemic, Dr. Scalea is physician-in-chief at the University of Maryland Shock Trauma Center in Baltimore, and System Chief for Critical Care Services, as well as Director of the Program in Trauma for the University of Maryland Medical System. Dr. Scalea is globally recognized as a pioneer in leadership and advancing the field of shock and injury care, including from gun violence. He heads the only freestanding trauma center in the nation and the best known trauma center in the world. Each year, it cares for more than 8,000 critically injured patients with a 96% survival rate. Last year, he was on hand as the university announced a new Center for Violence Prevention that will look for solutions, and he will lead that center. Dr. Scalea, we thank you and your team for your life-saving work and for joining us this evening. Please offer a few opening remarks.
Well, thank you for the kind introduction. It's a lot of titles, but what I mostly am is I'm the busiest surgeon at the University of Maryland. I take care of a huge number of people, and a bunch of those people have been injured by violence. And if we look at per capita homicide as some measure of the magnitude of violence, the city of Baltimore is at the top of the nation and has been for some time now. And I would ask you to look at this a little differently. Trauma is a disease. It's a disease like heart disease or cancer. It has a prevention strategy. It has a treatment strategy, it has a rehabilitative strategy, and the whole point is to get from injury to reintegration in society the most efficient way. But this is us taking care of injury that has already happened. And prevention is the best strategy, right? Primary care prevents diseases, not smoking, eating well, going to your checkups prevents early cancer screening. All of this prevents diseases. And so the question comes up, can we realistically prevent injury? And the answer is we've known for 30 years that we can. In 1996, my young then partner, Carnell Cooper, began the work that started the first hospital-based violence intervention program in the country. Here in Baltimore. And Dr. Cooper, being a wonderful academic physician, created a strategy and then tested it and said, does it work? So he took young people over the age of 18 that had been injured in violence and had had at least one interaction with the criminal justice system and randomized them. He assigned them either to the program or the usual. And not surprisingly, there was no difference between the groups that were either put in the program or the people who were not. But every measure of cost, recurrent violence, incarceration was better in the group that was assigned to the violence intervention program. And none of this required huge understanding. It was about getting people hope. It was about giving them vocational training, giving them an alternative to the way they had been living in the past. And the results were long lasting. Despite this, we never were able to find anybody that was willing to fund the program. We funded it out of shock trauma operational dollars for years and years and years. And when we're so focused on preventing other diseases, it was inconceivable to me that we wouldn't invest in the youth of our city, because that is most of who is injured by violence. Why wouldn't we? Well, up to several years ago, we're sort of fighting the good fight. And at that point, I took care of a man that we were asked to transfer, and I was happy to do it. We say yes to everybody. And I cared for him and his wife. He ultimately, he was in the hospital a long time, and he left and went out. And about a year later, I got a phone call that said that the wife wanted to say thank you to me. And I said, that's fine. I'll be happy to call her. She said, and it was Don DeVries, said, no, Tom, she wants to really say thank you. And I said, oh, okay, she could call me. Is that it? She said, no, she wants to say $2 million worth of thank you. And I had no idea that Betsy Sherman was able to make that kind of gift. But the Sherman Foundation has made a gift of $2 million to the University of Maryland via me. And we have created the Center for Violence Prevention out of that. There was a bunch of press as we kicked it off a few months ago. It is a joint effort between the School of Law, the School of Social Work, School of Medicine, and the Shock Trauma Center. I am sure to increase in its partners. And it turned out, unbeknownst to me, that there were a huge number of efforts that were already ongoing at the University of Maryland, Baltimore. They didn't know about ours, we didn't know about them, and the center will provide an administrative umbrella to organize all of these efforts under a single administrative platform. And we are hopeful that this will allow us to understand, to investigate, and to treat. This is a center that will not exist just on campus. That would be silly. This needs to leave the ivory tower and go to where the people need the work. And we are completely committed to doing that. I can't name a name yet, but we have just offered a contract to the person we hope will be the first executive director. I hope to be able to make that announcement in the next week or two. And we are going to hit the ground running in order to do our part. Now, there is great redundancy in violence prevention, and it just seems to me that if we could all get our efforts together, there are 9 violence prevention programs in the trauma centers in the state of Maryland. Why do we need 9 separate infrastructures? We don't. So it is my hope that this is going to start a collaboration and level of cooperation that is going to let us do what we have been trying to do for 30 years. It's a public health problem. It needs a public health solution. We're delighted to be part of it, and I'm really very grateful that I was able to spend some time with everybody tonight.
This is really exciting, Dr. Scalea. Thank you for telling us about it. I will be in touch with you very soon to find out about the executive director. Our final panelist this evening is Archbishop William Lori, the Roman Catholic Archbishop of Baltimore. Born in Louisville, Kentucky, he has served as the 16th Archbishop of Baltimore since May 2012, and also chairs the Board of Governors of the Maryland Catholic Conference, the church's lobbying arm in Annapolis. This past November, Archbishop Lori was elected Vice President of the United States Conference of Catholic Bishops. An outspoken leader and opponent of violence, especially in Baltimore City, the Archbishop highlighted the surge in gun violence in his 2018 pastoral letter, The Enduring Power of Dr. Martin Luther King Jr.'s Principles of Nonviolence, a Pastoral Reflection. Archbishop Lori, thank you for convening this important conversation this evening and for being with us. Would you offer some opening remarks?
Thank you so much, Sheilah, and thanks to my fellow panelists, to my good colleague, Msgr. Bozzelli, and to Jenny Kraska. It's great that we're together tonight. Together with many of you and with Msgr. Bozzelli, we call Baltimore our home. And so the issue of gun violence is not simply an abstract policy issue. It's not simply a matter of public policy, though it is all of that, but it is also something that is very personal. And as Senator Carter says, it goes to our values. It goes to what we hold near and dear, and it's part of cherishing human life and human life at every stage. So this is something I think that is important. I also want to say that this panel exemplifies, I think, the approach we need to take, and they can't. To Dr. Scalea's point, we don't need to silo this. This is something we need to do as a network of legislators, healthcare professionals, policymakers, and faith leaders. And I think that's really important. I could like to say just a word about advocacy. The Maryland Catholic Conference has for years advocated not only against gun violence, but for gun control. And I think that is very true of the United States bishops as a whole. Back in '94, we put out something called a Catholic, Confronting a Culture of Violence, a Catholic Framework for Action. And we talked about our obligation to stop, especially gun violence, whether in our homes, our schools, and our streets. We followed that up in 2000 with the document on crime and criminal justice, talking about support for measures to control the sale and use of firearms, especially efforts to prevent their unsupervised use by children, something that's right before us now. And through the years, we've supported a whole raft of measures of gun control, including a total ban on assault weapons, measures that would control the sale and use of firearms, universal background checks, limitations on civilian access to high-capacity weapons and ammunition magazines, a federal law to control gun trafficking, regulations and limitations on purchasing handguns, measures that would make guns safer. And those are federal measures, but I think as we've already observed on this in this meeting tonight, what happens at the federal level forms a very important backdrop for the legislation that we want to do here in Maryland. And let me add that the Maryland Catholic Conference has consistently, year over year, supported the efforts of the Maryland General Assembly to control the access to guns and to control gun violence. To say also a word about prevention, I think that one of the things we recognize is there are multiple causes. I think Senator Carter, you certainly brought that out so clearly. Parish communities like the great St. Bernadette's are a sign of hope in our city, a place of belonging, a place where people have a chance to connect with God and with one another. I don't think we should discount the importance of our places of worship in our city. I also just want to mention briefly the kinds of services offered by the faith community: mental health services, counseling, case management, and an array of health services that are available either through clinics or through other healthcare centers, like Mercy Hospital just down the street from where I live. I'd also want to mention Safe Streets, which is a violence interruption program that Catholic Charities is involved with other partners like LifeBridge. We are involved in 4 places: Cherry Hill, Brooklyn, Curtis Bay. We're also involved in Sandtown, Winchester, and Penn North. And I think that these are really courageous folks, well-trained folks They know the scene. They know the scene granularly and are willing to put their lives on the line to prevent shootings. And I think I remember tonight very much Mr. Barksdale, who lost his life as in an effort to prevent gun violence. So I want to just take a moment to thank everybody for your leadership on this issue. It's near and dear, and I hope that we will continue to collaborate together to do everything we can to address this legislatively and in all of its multiple causes, and above all, to offer hope and help to our fellow residents, not just in the city of Baltimore, but beyond Baltimore as well in the state of Maryland. Thank you.
Thank you, Archbishop Lurie. I echo your thanks to everybody taking part in tonight's conversation. Our panelists already have given us so much to think about, and I'm eager to engage all of you in discussion based on the questions we've received. I'd like to remind our audience that you can submit questions by using the chat feature, or you can send an email to communications@mdcatholic.org. Again, that's communications@mdcatholic.org. Our first question is for Delegate Klippinger. Tell us more about some of the priorities of the House of Delegates legislative approach to addressing the issue of gun violence in Maryland this session.
So there are a wide range of things that we're going to be working on here in the House and in the General Assembly as a whole. I'm going to focus on the issues that we'll have here in front of the Judiciary Committee, but there are certainly issues related to addressing issues that the governor spoke of in his State of the State and eliminating child poverty, and a wide range of other issues that other committees will be addressing over this session as well. So I don't want to say that these are more important than those or those are more important than these. There's just some of the issues that we're going to be dealing with here in Annapolis this year. In the Judiciary Committee and in the House, House Bill 824 is legislation that I drafted in response to the decision that the Supreme Court made that I mentioned before in Bruin, that requires us here in the state of Maryland to change the way that we license people who apply for what are called generally concealed carry permits to carry a handgun. What the Bruin decision said is they found that Maryland's current licensing structure was unconstitutional because we provided the state police for discretion so that they could look at the whole picture surrounding a person as opposed to just having an objective view. They said, the Supreme Court said, it only needed to be objective. It could not be subjective in any way. And so we're going to have to change our structure to reflect that. The legislation that was drafted here in the House and that we'll be beginning with here would address specifically that licensing process related to concealed carry. It would remove unconstitutional language that the Supreme Court has identified as unconstitutional. It would increase the fee for getting a wear and carry permit, fee that hasn't been raised since 1992. It would restrict a person who from possessing or wearing and carrying, or effectively having a concealed carry permit, if they're convicted of our existing storage bill. So in other words, that bill basically says if you leave a gun and you know or should have known that it could be found and used by a child, that is already against the law. What the bill would say is not only is it against the law, you would be restricted from purchasing or from wearing and carrying a firearm for 5 years on a first violation, a lifetime ban on a second violation. A lifetime ban would also be imposed if the gun was then used by the child to kill or seriously bodily injure somebody else. We also expand the list of people who cannot apply for a firearm license, including those people who are on supervised probation for any crime that carries more than a year, or people who have violated a protective order and are on supervised probation for that. We also assure that no one who is currently under a protective order or under what's called a red flag order because they have a mental health issue where they've been identified as somebody who should not possess a firearm. We include that in those people who are restricted from being able to possess a firearm. And finally, we also strengthen the education component of getting a wear and carry license by requiring more education on de-escalation and the use of force and the rules related to use of force, so people not only understand the state laws, but the federal laws regarding these issues and the new practices that are out there so that we can avoid confrontation that ends in a gunshot and seek ways to stop that from turning violent in the first place. This bill is one step on the side that we have to take. We have to take it because the Supreme Court found our laws unconstitutional. There's going to be a larger discussion with regard to storage bills also in Maryland, although this includes one way forward that we could look at for storage. But this is part of the way, and certainly Senator Carter is going to, I'm sure, talk about what the Senate has been working on as well. But we hope, I certainly hope, that we'll be able to come together with a comprehensive solution by the time that we leave here in April.
Thank you, Delegate Klippinger. Our next question is from Myles Hicks. Mr. Hicks, Maryland has the 7th highest firearm homicide rate in the country. Governor Moore, as you know better than I, actively campaigned to address the state's gun violence epidemic. What are the governor's top priorities in his first legislative session on this issue?
Yeah, so I think to start the conversation, there's a lot of ways to tackle gun violence in this nation, and one of them is actually addressing some of the root causes of them, which includes housing, fair wages, making sure that everyone has food on their table and can protect and service their families. So for us, some of our top pieces of legislation include the Fair Wage Act, which increases minimum wage. You also have the SERVE Act, which is really going to give people in high school the opportunity to have a service year. So instead of having idle hands in your community, people who are sitting around and don't have time, this is a program that's going to give some of these students or some of these people the opportunity to learn more about how they can get involved in the state, how they can get a job, how they can utilize their skills and put them towards state service. So one thing we're really focused on is really building up our next generation, really stepping in where these kids need as much help as possible and giving them opportunity to actually put some money in their pockets and work a little bit. So that's one way that we're just trying to help this process, along with supporting some of our great delegates and senators like Chairman Klippinger and Senator Carter.
Mr. Hicks, thank you. Dr. Scalea, you witness far too often the impact of gun violence, the impact that it has on individuals and on public health in general. Numbers and statistics aside, can you in just a couple of minutes talk about what the human toll of gun violence is and how your work has been affected by your exposure to such violence?
2 minutes is makes that a little complicated. Let me just make a couple of comments on the long-lasting effects of violence. People that come in, and I have several in the hospital right now, that have serious injuries to their torso, will often take me somewhere between 1.5 years and 2 years to actually get reconstructed and get them back to what is going to be their new normal of living. And for an 18-year-old or a 20-year-old kid, that's a substantial portion of the time they've been on Earth. And it's very hard for them to come to grips with the fact that they're not going to be the person that they were before. I try to put myself in the patient's place and work to the best solution. Not too long ago, I took care of a 40-year-old man that had been shot a number of times, and it took me about 2 years to get him reconstructed, and I saw him afterwards. And this was a complicated set of therapies, but we got it done. And I'm telling him, you know, you're finally back. You're gonna be fine. And he looked at me and he said, I'm not fine. And it turned out he had been shot in his arm as well as his abdomen and his chest, and he had nerve injury to his left arm. And he makes a living picking up heavy boxes. And you need two arms to do that. You can't do it with one arm. So after all of this suffering and 15 major operations to get fixed, he's disabled. He can't work. He lost his relationship. He lost his home. He's now at that point, he's couch surfing, sleeping on friend's home, and he's disabled. This is not will be a lifelong disability for him. And what can we do to help him? I'm not sure, but we are certainly trying to get him into some vocational rehabilitation and get him to the point where he would be able to support himself again. This doesn't even begin to address the emotional toll on the patients. Again, I had a young 20-year-old kid came in shot in the arm, and he had a bit of a complicated go with a vascular injury, and we get him fixed. And I go to see him one morning, and I said, you know, we're going to have to go back to the operating room. You've got some pressure in the muscles. We need to release that so that you can recover. And he starts to sob. And so I just sit there with him for 4 or 5 minutes, just holding his hand. And I looked at him and I said, are you having nightmares? And he said, every time I close my eyes, I see that guy pick up the gun to shoot me again. And he's, of course, emotionally, he's a wreck. And this is, you know, of the 700 or 800 people that we see shot in a year, 600 or 700, I guess. These are recurring themes. And so fixing these people is not enough. It is restoring their sense of well-being, which is a really hard thing to do, particularly when they are going home to the same environment that they lived in when they got shot. And
some idea, Dr. Scalea, of how complicated this is. We're getting short of time, and I do want to ask Senator Carter. Thank you, Dr. Scalea, for that insight. And Senator Carter, let me take a similar question to you and ask you for a relatively brief answer of a big problem. Gun violence disproportionately impacts people in communities of color. How have you seen this firsthand? And what do you want us to know about what we can do about it?
As I stated, I've seen it all my life growing up in Baltimore, but particularly most troubling in recent years. And one of the things we can do about it, and I would say to the Catholic Church and all faith leaders and faith institutions, that it's very important in places like Baltimore City to address the trauma that young people experience, as Dr. Scalea has talked about, but also address the social pathology that inherently sends messages to young Black boys and girls that they are worthless, valueless, and inherently criminal. People tend to act like they are what they are prescribed to become. And I think that is a big part of the problem in Baltimore City and right now and for decades. I think that we've got some incredibly good solutions, but again, we've got policy solutions that I think are smart. We have to be smart on policy. Let's be clear. When a young person lives every day in a culture of kill or be killed, one additional year of a potential sentence isn't going to change anything. We have to be smart about policies. If a young person is in possession of an illegal gun, one of the first things we should ask is why? Where's the adult that's responsible for that, and what can we do about that? But in addition to that, we need to educate that young person about anger management, about gun violence, and about gun safety, and try to prevent any violence from coming. And I'll just end with this. The AFT statistic for 2020, the year 2020, says that in Maryland, our time to crime ratio is higher than the national average, meaning it's about not almost 10 years from the time a gun is purchased legally, sold in retail, until it's found in a crime. So there's a 10-year window that is going somehow unchecked, and there's a lot more that we can do to fix that as well. I'm not sure all the solutions, but I do know that we're not doing enough at the high level traffickers, retail sellers, and volume dealers.
Thank you, Senator Carter. Archbishop Laurie, let me throw the last question to you and ask you again, not nearly enough time for as important as the topic is, but what in particular can faith leaders do to address what we've been talking about?
A couple things. One is we have to accompany those who have lost loved ones through gun violence. We have a grief ministry. I think that, as I mentioned earlier, mental health programs are very, very important. It's one of the roles that our community schools plays too. They reach the families, and they give our young people a sense of their God-given worth, and we really try hard to help them succeed. They're just not schools. They are places where we are trying to help as many young people as we possibly can to succeed and to escape a culture of violence. I also think that in addition to services, I think that interrupting violence is just hugely important. I mentioned the 4 sites that Catholic Charities runs. I think that interrupting violence, but also understanding the causes of it is really, really very important, and something that we really endeavor to do. I wish I had more time, but that's a little thumbnail sketch, and just another word of thanks to everybody on this Zoom. Great perspectives tonight. Thank you.
I echo your thanks again, Archbishop Laurie, and in particular, I want to thank the Maryland Catholic Conference for hosting this important conversation. And, with a full heart, I turned to Msgr. Bozzelli of St. Bernardine's Catholic Church to ask for a prayer. Goodness, we need it.
Indeed we do. And thank you all, everyone on the panel as well, for being the witnesses of hope for us. As someone who not only ministers in the neighborhood at Edmondson Village, but lives in it every day. Witnessing at least to hope and help is an important part of it all. So let us pray. Good and gracious God, who loves us so perfectly, help us to better love you and each other. Touch our hearts with your love, heal our brokenness, turn us away from violence, and help us to seek peaceful ways of resolving our differences. May we reach out to those who feel alone, to those who live in fear, to those who struggle with mental health, to those who see no alternative to violence. May our law enforcement officials have the resources they need to protect us. May our legislators commit to sensible policies and laws regarding the availability of guns. And may our federal, state, and local governments provide the resources needed to address the health and welfare of us all. We ask this in your most holy name, one God, forever and ever. Amen.
Amen.
Thank you, Msgr, and thank everyone who took part in tonight's discussion. If you missed some of it or just want to listen to it again, it's on the website at the Maryland Catholic Conference, mdcatholic.org. Thank you and good night.
And everybody.